Got rid of that. Afternoon, everyone. I'll just give you a moment to take your seats, get relaxed for the last exciting part of the day's activities. I'll just introduce myself. I'm Jim Mackie. I'm the Acting Chief Executive of the Clinical Excellence Commission here in New South Wales. And it really is my pleasure to kick off this final plenary of Keynote of the day from Dr. Ashley Bloomfield, who's the Director General of Health and Chief Executive for the Ministry of Health in New Zealand. Ashley trained in medicine at the University of Auckland and later completed a Masters of Public Health. He's held several leadership positions, including the Chief Executive of the Hutt Valley District Health Board from 2015 to 2018, been Director of Public Health and also had a stint at the World Health Organisation. His interests are in public health and prevention of non-communicable diseases, and recently he's been influential in the leadership of the response to that wonderful, well-known condition called COVID-19. And so I want to thank you all for coming late in the afternoon on a Sunday and a beautiful afternoon, and welcome Dr. Bloomfield for this keynote. Thank you very much.
Oh, well, for those of you from afar who have travelled to Australasia or Australia to get here, good afternoon. To our Australian colleagues, g'day, and to the fellow Kiwis in the audience, kia ora whānau. Nice to see you all. It's a real privilege to be invited to be part of this conference alongside some amazing plenary speakers, people like Helen Bevan and Don Berwick. I first heard Don in New Zealand probably over 15 years ago, a big conference in Auckland, his first visit there, and several things stick in my mind. The paperboy wisdom he shared about people who are jerks, and his wonderful phrase, the first time I'd heard it, but it's been helpful through my career: all models are wrong, but some are helpful. So I won't be here to hear Don, but I'll be hoping to watch him online. It's just lovely to be here. The title of my presentation today, Walking Backwards into the Future, is reflecting a Māori whakatauki, or proverb from New Zealand, and that proverb in Māori says, kia whakatō muri te haere whakamua. I walk backwards into the future with my eyes fixed on the past. It speaks to Māori perspectives of time, where the past, the present, and the future are viewed as intertwined, and life, of course, is a continuous cosmic process. So I wanted to take the opportunity today to walking backwards into the future, to look and reflect a bit on some of the lessons I've learned from COVID-19 in the first part of my presentation, and then to reflect on what that might mean for, in particular, improvement science and quality improvement and safety. However, for those of you who are not New Zealanders, I just want to set the scene with a few of the key events that happened in New Zealand, particularly early on in the pandemic, that set the scene for our approach to COVID-19, which was by no means unique, but we certainly made a key decision to go for an elimination approach for the first couple of years of the pandemic. So the first stand-up I did was the 27th of January, 2020, and at that stage we also started to look for signs and symptoms amongst people who were travelling from China to New Zealand, so late January 2020. And by this stage, there were only about 2,800 cases around the world, and the global death toll was 80. And the WHO hadn't even yet declared COVID-19 a public health emergency. They did that a few days later. But things just escalated so rapidly, as you may well recall. By the 3rd of January, we had stopped anyone who had been in China for the preceding 14 days being able to travel to New Zealand. On the 6th of February, we flew a number of New Zealanders and Australians out of Wuhan and into Auckland, and then isolated and quarantined them in a facility for 14 days, doing all these things for the first time. And that was the beginning, really, of our approach to developing what we called managed isolation and quarantine, which was in place for nearly 2 years, where everyone coming into the country, bar very few people, had to spend first 14 for most of that time, 14 days, and then subsequently 10 days in a hotel with very rigid infection prevention control procedures in place. We didn't get our first case of COVID-19 till the 28th of February. I know that date because I was off. I had a couple of days off and I was off mountain biking with friends in the South Island of New Zealand, wonderful place, and got the call just after I got out of the bush, as we call it, and had to fly back to Wellington to announce it. But one of the features of our approach was to try and give ourselves time. Time was everything. A couple of weeks or 3 weeks to make decisions was really important. And so not getting our first case till late February was of huge help in getting us set up. So saying, like many countries, New Zealand had planned rigorously for a pandemic of influenza. The only problem was we had a pandemic of coronavirus. And so after the first 2 or 3 weeks, we had to put our pandemic plan, it was about this thick, which is 2.54 centimetres, or for those who are still using imperial measurement, an inch thick. We had tested it, but we had to put it to the side. And from that point on in time, we were, as my boss describes it, in public service parlance, we were learning it forward, otherwise known as making it up as we go along. But every country was. The single biggest decisions that we had to take were in March 2020, when we decided to effectively lock the country down as case numbers escalated. People were required to isolate at home, but we were seeing case numbers escalate. And on the 24th of March at 11:59 p.m, we went into a lockdown, and effectively we asked all New Zealanders to stay at home, except for very, very small number of reasons for leaving home, and asked them to stay in their bubble at home. Some months later, when we did that, we set out to what we were hoping to do was bend that curve, that the infections were going up, and we were hoping by doing that to bend the curve to get the numbers down to a level where we could manage them. And in fact, New Zealanders embraced the challenge, and also there was a modicum of fear and uncertainty and an obvious concern and anxiety. People really took on board what was asked of them, and so we ended up actually completely eliminating the virus from the community. And by the 8th of June, we had lifted all our lockdown restrictions and then had a period of 100 days where there was no community transmission. We found it again in August. We had another outbreak, small one. We used the same approach, and we got rid of it again. So over most of the 2 years of COVID, aside from when we were dealing with 3 outbreaks, the last of those, the Delta-related outbreak, and that was the hardest, but we had almost got rid of that when Omicron came along, and that was a game changer. But for much of that time, New Zealanders experienced no limits on what they could do. We were holding large concerts. There was free travel right around the country. We didn't need to use masks or anything. But of course, the price of that was that anyone coming into the country needed to go into managed isolation. And because there was a limit on the number of people, there were many, many people who couldn't get into New Zealand, and that obviously had quite an impact. So that's just to set the scene. I still am until Friday this week, Director General of Health in New Zealand, and then why I'm smiling is because I finish in the role, and I'm taking a 3-month break, and I'm leaving things I know in very, very capable hands. But what I wanted to do was just share 5 main lessons that I learnt, or perhaps ones that have been confirmed to me during the pandemic and my time as part of the leadership of the response in New Zealand. And I call them lessons in life and leadership because the two are so intertwined. The 5 I'll go through is, first of all, leadership is an invitation to collective action. Second, the counterpart of leadership is teamwork. They're like 2 sides of the same coin. Third, strong, clear values that underpin your behaviours are just fundamental to good leadership. Fourth, trust is fundamental in leadership, and it relies on, first and foremost, on honest and open communication. And finally, leadership's about making decisions. And even when you're in that terribly grey area of a pandemic with very limited knowledge, total uncertainty, you could say, very limited ability to manage context or lead context, you have to make decisions. So I just want to unpack each of those, first of all, and then I'll Then I'll talk a little bit about what I think that means for quality improvement and safety, and then I am going to leave time at the end. I will be sick of speaking after about half an hour, and you'll be sick of listening to me. So I'd love it if you had questions, and we've got a chance for some dialogue afterwards. So the best definition of leadership I've ever heard, and it came from a disability advocate, and it just struck me as a fantastic definition. Leadership is an invitation to collective action. So I just want to unpack the three elements of that. First of all, it's an invitation. You can't force leadership upon people. You can't say, right people, here I am, follow me. They have to want to follow. So you're extending this invitation to people, and they need to accept the invitation and own the vision and the direction that you're articulating. And you also need to involve them in building that vision and direction. So it's an invitation. It's about collectivity. It's about working together. Leadership, yes, a part of good leadership is leading yourself, but otherwise it's a communal activity. But it's about the collective. And finally, leadership is absolutely about action. Absolutely about action. One of the great analogies I've heard about leadership is it can feel at times, in fact most of the time, like you're wading into a swamp. It's hardly very enticing. But the thing about standing in the swamp or being in the swamp is if you stand still, you start to sink. And so leadership is about action. It's about constantly looking forward and thinking about what next. The thing about extending that invitation to people around collective action is they have to understand the why. And often as leaders, we spend too much time focused on the what and the how. If people understand the why, and we saw this time and time again in our response to COVID, they know what to do. The individuals and teams in our organisation, communities, family and individuals, if they understand why, they'll just get on and do it. Remarkable things. And this was absolutely fundamental to our success with our elimination strategy. People understood why. When our Prime Minister, Jacinda Ardern, extended an invitation to people, she said, here's what I want you to do. Here's the invitation. Stay home, save lives, be kind. It's very simple. And people owned it and did it. Just the other comment on that, it's very different from stay home and look after yourselves. It was stay home, save lives, be kind. Stay home and look after each other. And people did it. Communities did it. Neighbourhoods did it. Our iwi, our Māori groups did it. Pacific communities, churches did it. It was remarkable, the power of collective action, what it achieved. And of course it then became important for some of those other actions where people engaged with and were prepared to use masks, physically distance, get vaccinated, etc. So that's that first point I wanted to make. Leadership is an invitation to collective action. And then the counterpoint of leadership is teamwork. The two go hand in hand. You can't lead without a team, and so teamwork is absolutely critical to success. And that's why a good team will have people on it who've got different skills, and they know each other's skills and strengths, and they absolutely play to that, and they support each other. There's real loyalty to each other there. And I was fortunate, I had been in the role of Director General for 18 months before the pandemic came along, and I'd had a chance to really work hard with the team that I'd built around me, our executive team, so that we really knew each other and backed each other and supported each other. And that was really critical to us being able to do our part in leading the health part of the response. The third point, values are fundamental to good leadership. I talked earlier on about a global pandemic. In a global pandemic, the three dimensions of leadership: leading self, leading others, leading context. It's quite hard to lead context when it's a global pandemic because you don't know what's going to happen. No one does. And so you have to really focus on what it is you can control. And the one thing you can always control as a leader are your behaviours. You can always control your behaviours. And of course, our behaviours are an expression of our values. We judge ourselves by our intentions, others by our behaviours. And so I was very focused on thinking, what are the values I want to convey in the way I come across, in particular in those, the many stand-ups I did, over 300, and many of those through the elimination phases with the Prime Minister, explaining to people what was happening, asking them to do things often that were really impinging on their fundamental rights, but they still did it. And of course, values are particularly tested when things don't go right. That certainly happened in our response. And so you really have to lead from the front in a very values-based way when there's criticism, justified or not. And it's an amazing motivator of staff or of your team members, and how they will, in the discretionary effort, they will then apply, particularly when something's gone wrong. And the media, of course, they go straight for their two favourite words, the C word and the F-bomb, crisis and failure. Everything that doesn't go absolutely right is a failure. And staff who your staff, they've been working absolutely more than beyond what we could expect of them. They haven't been seeing their family, they've been doing extraordinary work, and then suddenly there's a tiny little slip up. In our case, it would be if there was a case found in the community. And the media would go absolutely straight onto it. There's a failure, who's responsible? And those are the times when I certainly had to, on several occasions, stand up and say, actually, I'm responsible for the system, so I'll take responsibility. Here's what we're going to do about it. And it's amazing, your staff will watch that, and your team members will watch that, and knowing they're not going to be hung out to dry or thrown under a bus. And I certainly had that, I wouldn't say requested of me, but I had people asking me, surely it's not your fault, who was responsible? And I said, well, I'm responsible for the system, so I'll take accountability and ownership. Trust is fundamental, is the third point I'd made, and I talked about honest, open, clear communication. It's absolutely essential to build trust, and of course that operates even at a clinical level in working with patients and their families. That open communication, and communication is a two-way exercise that starts with listening. So taking the time with colleagues to build that high trust environment, as I said, teamwork, learning about each other, considering their potential, not just as individuals, but what you can achieve as a team. But the key thing that really was fundamental to our response, and people say, what was the most important public health measure in your response? And in our response, it was absolutely good communication. So building trust with the public. And when we started on the 27th of January, myself and my very good colleague, Dr. Caroline McElnay, stood up in a small room, and we said, the very first one, this is what we said: at this stage we don't have any cases. A high likelihood we will. We've also assessed that the likelihood of transmission, if we get a case to another person, is probably low to moderate, because we are prepared and ready. Oh, gosh. And at this stage, based on current information, our assessment is that the likelihood of a sustained community outbreak remains low. Now, in my defence, things were moving pretty quickly, and as you will well know, our knowledge at that point in time, and probably for the first 2 or 3 months, I could personally keep on top of all the published literature around COVID, because we were just learning so fast. But what happened after that first stand-up we largely did because the weight of media inquiries was just overwhelming, and so we decided we'll do a 1 o'clock stand-up and we'll answer all their questions, and then that will help us with managing the media. But they became a bit of a thing and a way for us to communicate with the public, and especially so when we were in that lockdown situation. And so people built trust based on the fact that we were being open and transparent about things. And that included at times, in fact a lot of the time, especially early on, for me was saying, I don't know, I'm sorry, or I don't have that information, but we'll go away and we'll get it for you. And then it became, the evidence has changed, and so we've changed our mind and our approach, and here's why. Now, this is not something politicians do very readily. There's not a whole lot of currency as a politician in fronting a media conference and saying you don't know, or you've changed your mind. It doesn't go down very well. But this is something, particularly because things were moving so quickly, and because I was a public servant, not a politician, actually found that it built trust. And when the chips were really down, and I had some pretty challenging media conferences, those ones usually alone, when something hadn't gone right, and I would be really taken to task. And I'm going to talk a little bit about one of those events tomorrow morning at the session. here's the thing, actually, being honest, people know exactly, even if you just miss a beat, people know if you're not being honest and open. And honesty and openness, but especially when things don't go right, and saying, yeah, that didn't go right, we could and should have done better, here's what we're going to do about it, and we're reviewing it, and I'll let you know, I will publish the outcome of that review. That's what builds trust. People go, thank goodness for that, someone not trying to astroturf things. So trust was fundamental. Final comment, my final point was around you just have to make decisions. And I talked about the swamp and being in, that leadership swamp. And, early on in the pandemic, I was very, very persuaded by a comment that some of you may know or have heard Dr. Mike Ryan. He's the very nice Irish fellow that fronts the a lot of the WHO media and has right through it. He's a fantastic guy. But right back in March 2020, he made this, in one of his stand-ups, he made a comment that really stuck with me. He said, be fast, have no regrets. If you need to be right before you move, you will never win. Perfection is the enemy of the good. Speed trumps perfection. Everyone is afraid of the consequence of error, but the greatest error is not to move. So, as I say, leadership is about action. It's about moving forward in the swamp, because if you don't, you'll stand still. So I was in a very fortunate position. I had great people around me who I could test my ideas with, politicians who were listening, and we do have an advantage in New Zealand. We don't have a state system, it's just a national government, or equivalent of Commonwealth government here in Australia. There's only one house, it's a unicameral system, and it's a pretty small country. So the only person who really has any security around them at any time is our Prime Minister. Other ministers will just be walking around the street as if they're an ordinary New Zealander. And so we were able to get really rapid decision making, and it was a time for that. And we came up with this sort of mantra: if you think of something you need to do in 2 weeks' time, we'd do it today, because 2 weeks' time was too late. And despite the things that went wrong around trust, despite those things that went wrong, the overwhelming feedback from the public that I receive, and they send letters and cards to the ministry now all the time. It's quite nice being here in Australia. I can walk down the street without being recognised, something I've had to get used to in New Zealand, and people come up all the time, and I've had thousands of people come up to me in the street, and they say that no one's been rude or unpleasant even, and they've just said, thank you for what you and your team have done, we're really grateful. So, what does this mean for continuous improvement, or for improvement and safety? Well, a couple of things. The lessons, I think, are the same. Good leadership, an invitation to collective action, teamwork, values, trust, and making decisions, doing things, not being afraid to make a mistake, but then making sure we review and learn, and I'll come back to that. Well, I found out through the pandemic, the desire to apportion blame, is still very strong. And I think even 20 or more years into the improvement and the quality improvement movement in health systems, this is still where at least the media go straight away. And the damage of that word failure, as I talked about, we had some situations. For example, we had a number of times when we did have small community outbreaks because something had happened in the virus. It's a tricky virus, but it had got through the barriers and all those measures we had in place in our quarantine facilities. But, immediately the media go for this. There's been a failure. And it's really important, as I've said, that we take responsibility to say, yep, there's been a mistake. But there's still this desire for heads to roll. I had it even recently in February. We had a big backlog of testing in February that took us, that meant some people's results were slow coming back. I commissioned a review, and I then spoke to that in the media in May, and I had one of the reporters who I did an interview with afterwards, and he said, has anyone resigned as a result? I said, no. He said, well, if you were leaving, would you be resigning? If you weren't leaving already? I said, well, no. I don't necessarily think that would help. But there is still a very strong desire for this. And it's quite remarkable. I was quite surprised. When I was first asked about failures, I just, on the spot, came up with this thought, which I've used since, that in fact the only failure when things go wrong is the failure to learn, to review, to understand, to learn and improve, and then review again. And I found that really quite helpful as a way of batting away this notion of failure. The second point, of course, that I just really want to emphasise is that point about reviewing. And we worked out we'd had so many reviews of our approach and of our response that we had around 1,500 recommendations from those reviews over the last couple of years. The most important, the most useful reviews were the ones that I commissioned myself. And so a good lesson to remember about reviews is commission it and get someone to come and do it before you get it done to you. Because the ones that were done to us were way less useful. They were done in a much less constructive way, a much less iterative way. And generally the recommendations weren't as useful or as relevant to the situation that we then found ourselves in. But getting into that habit, and of course it's fundamental to improvement, isn't it, is that constant review, to review, understand, and that's often the bit we miss out. We often do the review, we say here's what happened, and then we go to recommendations, but it's actually trying to understand, to go deeper, that really makes the difference. Some of the first reviews that I was able to commission were really helpful. I commissioned one from a medical colleague. She actually went on to become an MP at the next election and a minister, and she's now an Associate Minister of Health in charge of the COVID response. But she did a review of our contact tracing system, and it was so helpful, so well done in terms of that, seeking the right information and then coming up with some recommendations that once we saw them through, we had this excellent contact tracing system. But of course there's also a fine line in having too many reviews and expert groups, and the balance starts to tip into a place where you end up spending so much of your time and energy and effort responding to reviews rather than being able to get on and improve the work. So it's really important to get that right balance. Okay, so just want to finish up here actually with a couple more kind of leadership observations, and I'm sure they're not new to you, but I do want to leave them with you because they've been important to me. You'll have heard that old saying, people won't remember what you thought or said, what you said or did, but they will remember how you made them feel. And one of the things that was most important, and this goes back to values, most important from our response, particularly earlier in the pandemic, when people were really afraid. They were scared. We didn't know what was going to be happening. Our colleagues in the health system were terrified because they could see what was happening abroad. And as one of them described to me, all we could see was this dark tunnel we were going into, and we didn't know how we could avoid it. Yes, they would have done what they needed to do, but we managed to avoid the tunnel. The thing that people most remember about those daily stand-ups through March, April, May, and into June 2020 is not really what we said, but how we came across. And the most common thing that people say to me is, we liked it. The thing that was most important was that you were calm. Now here's the thing, I did not feel calm. My cortisol levels would start, so 1 o'clock stand-ups, 10 in the morning, almost like a clockwork, my cortisol levels would start to rise. I'd be prepping away. Then I'd walk down the road to our parliament and I'd spend an hour with the PM and we'd be prepping, and we'd still be writing notes as we caught the lift down to the theatrette we would do it. The 1 hour of presentation and questions on absolutely anything from political journalists who, they're pretty tough. By the end of that, I'd just be drenched in sweat and feeling, it felt like, it was like being in the Colosseum, I'm sure was, except without the tigers biting you, but metaphorically they were. So I didn't necessarily feel calm, but the projection of being calm made people feel like things were in hand and that it was going to be okay. And that was what got people through. And in particular, I get quite a lot of correspondence from people who had really quite, life-limiting anxiety or mental health issues. And that was, for them, they say, life-saving. So how you project as a leader and as a person is what people will remember. And my final comment, just back to the swamp analogy. Again, it's not such an enticing analogy. But first you've got to keep moving forward. But most importantly, as the swamp gets deeper and it gets tough, too often our gaze narrows and we just keep looking ahead. And it's really important to keep looking to the right and to the left and see that there are others alongside you, your team, who want you to succeed and who will also be there alongside you and supporting you in your leadership journeys. Kia ora. That's all I wanted to say by way of sharing my thoughts with you, and I really hope there are some questions or comments, and both here in the room, there are some microphones, I understand, 4 of them around the room, and also there are some that might come through online from some of our folk who are watching the stream. So thank you very much, and really appreciate again the opportunity to share my thoughts with you. Kia ora. Got a question over here.
Hi, I'm Todd. I'm a pediatrician in Auckland. So I was one of the viewers of your daily press conferences and appreciated what you were just talking about. What kind of processes went into planning how you were going to present things to the public and how you were going to try to reach people who might be difficult to reach or you knew would be objectionable to some of the planning?
Yeah, kia ora. Nice to see you. Well, 2 things. I talked about the preparation. So every day I'd be doing a couple of hours with my team, gathering up all the latest information we had, what we'd learned globally overnight, our data from around cases and so on, any new evidence that had emerged. And then that hour spent with the Prime Minister was really working hard on refining the messages to make sure they were very consistent right throughout, that we were prepped for things that could come up by way of questions, and that we had nice, coherent responses to those. Sometimes there were issues where, and this was a thing where we knew information that we weren't, it wasn't the right time to share it, but we had that information, and I would have a bit of a negotiation with the Prime Minister's press secretary about what I would say, because I said, look, if I even pause, that could undo all of that hard work we've done. And so very often I would just say, look, I've got that information, but I'm not in a position to share it today. As soon as I can, I will. So that was part of it. Interestingly, we saw that this huge swing to back to the mainstream media, and Kiwis in the audience, you will well know, and I think it was probably the same here in Australia. There was a joke in New Zealand at the time that if you wanted to go to the supermarket, which was one of the few things you could leave your house for, the best time to go was at 1 o'clock because everyone else was at home watching TV to find out what to do for the next 24 hours. So the thing it did create, so the mainstream media actually just became by far the most important way for people to get information. And it created a sense of unity at a time when people were forced to isolate at home in their bubbles. I think it gave them that sense of unity. There was a lot of effort that also went into working with, and this was, a great development was the use of Zoom and so on to reach out to community leaders for our Māori communities, Pacifica communities, a whole range of youth communities and so on, to get the messages out through a range of different channels. And here's the thing, at the start of the pandemic, our Ministry of Health didn't even have a Facebook page. And we set one up and got pretty high level of followership as well as Twitter and other social media. So those became another really important set of channels to get messages out to all the communities. Question down the front here, but in the meantime, there's one up there too, I think.
Ashley, Andrew Hallahan from Sydney Local Health District. I have to say, as a person watching what you were doing, it was textbook. I'm curious as to your, future prediction of the key challenges for the health system, both in New Zealand and similarly here, as we learn to operate a health system with endemic COVID.
Oh, thanks very much, and I appreciate the comments. Well, I'm going to focus my comments on one particular thing, and that's workforce. Who doesn't live in a country at the moment that hasn't got a shortage of nursing and medical staff? Is anyone in the room that's got plenty of those? Who doesn't live in a country where the health system is under a lot of pressure, and partly that's because staff are off sick with COVID and flu and so on, I guess in the Southern Hemisphere, maybe even in the Northern Hemisphere. Actually, I understand the UK hospitals are under a lot of pressure from COVID there at the moment. And I've been in, this is the end of 25 years for me with the Ministry of Health, and I've watched different health system structures, and I had a year at the WHO in 2011, so I know I've done a little bit of sort of comparative work on health systems. I think, here's the thing I think we need to change. We need to completely reimagine how we train and deploy and update our health workforce. We're still using approaches to this that are 20 or 30 years old and are just not fit for the current challenges. We've got more nursing staff in our healthcare system than we've ever had. And in fact, the numbers have gone up by around 16% in the last 5 years, and particularly a big jump in the last year. Every time we increase the numbers, the number of vacancies increases, and our nursing workforce doesn't necessarily get greater joy or satisfaction, and that's a real issue at the moment. Similar with medical staff, we've got apparently, we're 1,000 medical staff short in our health system in New Zealand. Yet, that's been the fastest growing of the professional groups in our health system. Of course, a very interesting, and here's the thing, a very interesting change in the proportions in different settings. So, like many countries, New Zealand, about 20 years ago, said we need to focus much more on a primary care-based system. Primary care and community care, it needs to be a much stronger focus. Well, in the subsequent 20 years, actually even just since 2005, our general practice workforce has gone from being 35% of the medical workforce to around 25%. So there's been a gap between the policy intent and its implementation. One of the things we learnt through COVID is that, and this was specifically around vaccination, we had some of the most restrictive regulations in the world about who could vaccinate. And we trained a whole new workforce, actually unregulated people with a really good, short, sharp training with supervision, and they ended up being able to vaccinate. And then we can add on other things to their, sort of like modules to their training and skills. So I think we need to reimagine the health workforce. I think we still are training. I'm not saying we don't need doctors and nurses and allied health professionals and so on, but I don't think our training is any longer fit for purpose. And I don't think we're deploying that workforce. And if we keep doing it, rest assured in 5 or 10 years' time, the shortages will be even worse. And the worst thing is, I think, people's satisfaction in their work will be lower. So I'm really interested, perhaps when I've had a holiday, to contribute to the thinking in New Zealand about how we might do that differently in the future. Thanks for the question. I think there was one over here.
Kia ora, Ashley. I feel empowered to call you Ashley because I know you so well from your daily performance, which was viewing. I think the one thing maybe was missing from your list of things to do with leadership was empathy. And that was one thing which came through loud and clear through that period, was the empathetic or empathic leadership that was shown by you and by the Prime Minister, which pervaded everything, and that's why I think people came along on the journey.
Yeah. Kia ora, I could tell you're a Kiwi by your accent. Thanks for that. Yeah, look, absolutely. Again, some of the feedback I get, and I'm thrilled, because what I was trying to do, and I had my formal farewell last week, and the Prime Minister was there, and in my speech I sort of apologised to her for sometimes being irreverent, not live on television, but when we were preparing, there was quite a bit of banter, and I said it was one of the reasons for that was so that we could feel comfortable with each other. I dare say, even though children ask me if she's my BFF, I have never called her by her first name, even when she rings at night to ask me questions, because we're there in our roles. But I said by being able to just be comfortable with you, I felt I could then come across in the way I wanted to be, which was calm and considered and compassionate. And certainly, again, the feedback is that's what people saw. And I think that's a really important element of leading. And again, whilst I was doing it in that role, it's absolutely opposite to how we interact with patients and whānau at a clinical level. And maybe one of the things I didn't emphasise enough, people don't expect you to have all the answers. That was a wonderful lesson for me. Thank goodness for that. It was okay to say, I don't know. And people just actually respected that and thought, well, at least it's telling the truth and not trying to make something up. And it's the same in the clinical situation, actually. I think we sometimes feel we have to know, but people are quite relieved when we say, actually, I don't know that, but let's have a conversation about it and we'll see what information we can get. Thanks for that question. I think there's one down the front here.
Hello, my name is Göran Henriks. I'm coming from the northern hemisphere, from Sweden.
Indeed.
Thank you for a brilliant presentation, and I think it was so nice to listen to a presentation that was totally understandable, so thank you very much. Now, even mine this morning was maybe not that, so thank you. Now, I think you are approaching the concept of competence in a way that we do not have courage to talk about it, because the whole description of leadership that you did was about a collective competence and not personal competence. Now, this is maybe a strange question, because I wanted to say this, of course, because I really believe in what you're saying. Now, how do you celebrate your successes to show that the collective competence have been important?
Celebrating success. I guess and the question is collective celebration, do you mean? Yeah, okay. Well, it's a good question. Actually, I just think, well, perhaps I'll make an analogy. Aside from recent history, we've got quite a successful rugby team in New Zealand. For the Irish in the audience, it was a great game. I was there, and you deserved to win. But to me, it's the same. It's actually, and this is one of the observations I would make about how our national rugby team is playing at the moment. Actually, on paper, it's got incredibly skilled, competent individual players, but it's what they do as a team that is the difference between winning and losing. And you can see that, you can see in the way a really good team plays a sport, that they're in tune with each other and they're not looking to necessarily show their own individual brilliance, because it's about the collective. And in my experience, and having played rugby in the distant past, actually I did play a game 2 years ago after 35 years of not playing. The team celebration is a very easy thing to have, and it's not focused on the individual. We had no problem celebrating our success, and the reason we didn't was because we could see it. We could see, actually, it was very tangible. So just to give you an idea, we've had about 1,200 COVID-related deaths in New Zealand to date. If we had the same rate as the UK, that would be about 13,500. In the US, it would be over 15,000. It's a wonderful thing to go home every night and know that you played a role in preventing those sorts of deaths. I don't think I answered your question very well, but maybe we can talk about it again afterwards. And I'm interested to hear your thoughts on this too, and I know Helen may well have some. Are there any more questions? We've got some online ones. Okay.
Yeah, I've just got an online question here. In your opinion, how strong is the impact of leadership on continuous improvement?
Oh, look, this is absolutely critical, and I may not have drawn the lessons across as well as I should have. But again, it's this idea of collective action and extending that invitation to people, which is, and again, harking back to Mike Ryan's comment, actually being afraid to err is a barrier to improving. isn't it? So being prepared to act, and then, of course, review and see how could we have done it better. And again, another lovely one of Don Berwick's sayings, paraphrasing, of course, because I can't articulate it just as beautifully as he does. But, you know, when we go to work every day, we've got two jobs. First, to do to care for and look after people as well as possible. And second, to consider and think hard about how we could do it even better. So our two jobs every day. So I think, you know, and again, my experience is from having been both a clinician and also a district health board chief executive prior to the role I'm in now, is there's enormous energy and enthusiasm for doing things better and ideas. There are just ideas out there. And our job is to extend the invitation to people to share their ideas and to try them and review and learn. Was that the only question online?
I've got two comments too. One was, kia ora, Ashley. One of the key things for me was your genuine approach. This came across. This came across, and we trusted you enough as a team to follow. So there you go. And also just wanted to comment on how I looked up to the approach that you took during the pandemic and the importance of consistency. Here in BC, Canada, a lot of people lost trust in the response from inconsistency.
Yeah, that's absolutely right. And the easiest way to be consistent is, of course, to be yourself, because then you don't need to remember who you were. And very early on, after a month or two of doing the stand-ups, things started to... I started to get a little bit of public feedback and became a bit of a thing, and T-shirts with my face on started to appear. I wasn't unique in this. It happened, I know, to colleagues in similar roles around the globe. Earrings, mugs, various other paraphernalia, tea towels, hand towels. Some guy even started a line in bathrobes with my face on them. I don't think that was a bestseller, but... Anyway, I remember walking back into my office after one of the stand-ups, and this had been happening, and my staff were laughing, and they said, "We don't understand what this is all about. We just see you up there being yourself every day. This is what you were like before." And I said, "Well, thanks. Tell me if you see that change." Because people know. And so that's about that. And it feels a little hackneyed, but it's one of those important things as a leader, to be your authentic self, of course. And that's what people will see. I think there's one more question here, and then I know it's the end of a day, and some of you will have jetted in from all around the globe, and even those who left New Zealand this morning were probably up at 4 in the morning, so if we can snaffle back a few minutes, I'm sure that'll be fine. Please, sir.
Dr. Bloomfield, thank you so much for the presentation. Despite my accent, I am a New Zealander, but I'm based overseas, so I'm going to have a comment and a question, if I may. My first comment is to say thank you, because as a son of 2 elderly parents in New Zealand, knowing that they were kept safe in New Zealand is something that certainly gave me a lot of comfort, not being able to be with them in New Zealand. So as a personal thank you to you and your team. My question, if you don't mind, is certainly there's been a lot of lessons that have been learned, and you've been very kind to sort of condense them and share them with us. And they're generic enough to help us in any other crisis, but certainly of a similar crisis that might come our way, and hopefully that will not happen in any time soon. But if it does, I'm just wondering, would you reflect and tell us and share with us, is there anything that you and your team would have done differently?
Oh, well, where do I start? The question I get most often asked by reporters, and at the moment I'm doing a series of sort of exit interviews, not the one that I had anticipated when I started the role. They say, have you got any regrets? And I go back to Mike Ryan, no regrets per se. Would we do things differently? Well, I've got 2 comments to make, and I'm sorry they're quite generic, but in a sense the value I hope of them is what will help us prepare for the next pandemic or the next major health crisis. The first is less detailed planning and much for specific organisms or things, but much more thinking, what are the really key pillars of an effective response? And a really important one is around absolutely clear leadership and decision-making lines. And then you want to think, well, what are the capabilities that we need people to have to be able to operate in response? And it's not technical capabilities, they're much more generic capabilities. So this is the sort of the reflections I'm giving to our cross-government preparation. So, And my view is we should identify, and communication has played such an important role. We should learn those lessons. And then we should work out and train people, a decent cadre of people, to be able to operate in that system, and then test it with all sorts of different things, rather than spending, years detailing out a pandemic plan for an organism that might actually end up being the wrong one. The second comment I would make, and this is a much more generic one, and actually touches a little bit on what at least I will infer from the topic of Don Berwick's presentation on Tuesday at the end of the conference. If we want to prepare for the next pandemic, the best thing we can do is address inequities in health and in our societies. I'm glad there's some other public health docs and others, because when the virus did get into our community, and I'm sure this happened globally, it was very obvious for us where it went. It went into our poorest communities, our most marginalised communities. This is what happened with HIV 30 years ago as well. Our most marginalised communities, our most vulnerable communities, the people who were either homeless or in very perilous housing circumstances, our poorer communities, and the best pandemic preparation is to address those inequities, and that's certainly something that, including in those determinants of health and well-being, you've got to address housing and so on. So those are just a couple of things, not so much things I would do differently, but I will try and answer your question. One thing that really struck me, and probably I was a bit slow to pick this up, was the amazing resourcefulness and capability there is in our communities. And our job, of course, is to enable them and to support and resource and inform them. And with that, they have then got an enormous ability to look after themselves and others. And so probably something we should have done earlier was, we did do it, but get really strong links out into those communities. And as I say, communication starts with listening, be able to hear what is it you need. They understood the why, but going out sooner and saying, what is it you need to really support and look after your communities? We did do it, but I think if we'd done it sooner, we may have well have been in a better position, particularly when we got to our vaccination program, which went well, but we would have probably been able to get those rates up amongst our harder, the communities we don't serve so well. We could have got them up sooner. I think that's the end of questions, and there's 4 minutes and 16 seconds to go, so we're probably coming to the end of our time. Or is there another question there? Perhaps take this as the last question.
Ashley, Matt O'Mara, I'm a paediatrician from New South Wales. I'm really interested in how you looked after yourself during this. While it was collective leadership, and you talked about celebrating success, inevitably there's a lot of pressure on you, whether it's the 3 hours and leading up to the press conference. How did you manage that? Because inevitably there's a lot of weight on your shoulders.
Yeah, kia ora, thanks for that. Yeah, it certainly felt like a lot of weight at the time, and I've been feeling that start to lift over recent weeks. So the big lesson for me around resilience was around resilience. And I've been blessed with really good mental and physical well-being through my life. I've been in senior roles for quite a while, 7 years as a chief exec, been in tier 2 or CE roles for over a decade. But I came a time, a few months into it, and actually I remember the day because it was a day I didn't have a media stand-up, but at 10 in the morning my cortisol levels went through the roof. I started pacing around my office, anticipating the stand-up, and realised, I need a break. And the lesson for me was about resilience. Resilient people are not the people that keep going. They're the people that know their boundaries really well, physical, mental, emotional, and they take active steps to stay within those boundaries. So they stay physically active. They do whatever it is that helps keep their mental and emotional, spiritual well-being centred, and that could be yoga or mindfulness or whatever. I don't do any of those, but things. I'm an active relaxer, so it's tearing down a hill on my mountain bike or something. But it's actually, so the resilient leaders are the ones who who say, yeah, actually, I'm getting near the end of my, my resilience kind of boundaries, and I'm going to step back for a bit. So that's a really important lesson for me. The other important lesson, and it's related, is as a leader, I now see it as an obligation of senior leaders to be honest about getting anxious and getting stressed. And it's hugely empowering to our junior leaders, because I've had them come up to me and say, oh, I really aspire to be a senior leader, but I thought I couldn't because I get anxious. I said, well, welcome to the human condition. I get anxious, I would get stressed before the stand-ups, and just sharing that and saying, yeah, certainly it happens, here's what I do about it, is I think, an obligation on senior leaders to, to be, and self-doubt. I said, remember what I say to people, if you find a leader without any self-doubt, don't work for them, because you won't learn anything, actually. It's leaders who have self-doubt and are prepared to share that and say, I don't have all the answers. They're the leaders you'll learn things from. Thanks for that question, and the opportunity to share that as well. Okay, I think that's about the end of the time, and kia ora again. Thanks very much.
Really well done, thank you. Thank you very much, Ashley. That was an inspiring piece, really. And it kind of caps off a really good day. If you think about the day, we started this morning early with Joran and Helen stopping time and taking the hands off, and here in the afternoon we're walking backwards into the future. I mean, the dichotomy is just fantastic, and it brings kind of, to me, improvement and quality to the forefront of thinking and challenging us all. There were many kind of inspiring presentations in between as well, and we thank everybody for their participation today. A lot of things have been said about teamwork, and I think it's worth just noting that a lot of the people running around in green shirts are volunteers today, and they come each day, or different people come each day, so I want to acknowledge them and thank them because it... Thank you very much for acknowledging that. That's very important to us. Tomorrow's a long time, and tomorrow there are more great sessions. I hope to see you all here early on to enjoy the whole day and to be inspired and to continue this really important work. So thank you and have a pleasant evening. Cheers.